Hello, my name is Regina, and this is my topic presentation for Cynthia Moore's class on the psychology of addictive behavior. I will be briefly talking about a few scientific findings on alcohol dependency, also called alcoholism. I first want to start out by defining what addiction means. According to the APA Dictionary of Psychology, addiction is defined as, quote, a state of psychological or physical dependence, or both, on the use of alcohol or other drugs. The term is often used as an equivalent term for substance dependence, and sometimes applied to behavioral disorders such as sexual, internet, and gambling addictions. The first scientific peer-reviewed article I would like to talk about is called Social Roles and Alcohol Consumption, a study of 10 industrialized countries. Kunsch et al. 2009 described two conflicting theoretical perspectives about alcohol and its association with social roles. The first theory, called classic role theory, suggests that the more social roles a person holds, the more his or her life is structured by meaningful activities that others expect one to engage in. Examples of social roles would include being a parent, being a son or a daughter, being a worker who receives compensation, being a teacher, etc. Every one of us holds at least a few social roles, some more than others. Several studies have shown that social roles are related to depression, psychological distress, subjective well-being, and substance use. In the last 20 years, several studies have demonstrated the link between alcohol use and individual social roles, such as being a partner or a parent. It could be assumed that the more everyday life is structured by social activities, which the individual and others deem important, the more likely it is that he or she will take care that the time spent in drinking situations or in drinking behavior, i.e. getting drunk or inebriated, they will make sure that that does not interfere with their role obligations. The second theoretical theory is called multiple burden hypothesis. Multiple burden hypothesis assumes that role overload arising from holding too many social roles and from possible conflicts between the demands of these roles, such as childcare and having to take on paid labor and employment, is related to stress, since each person only has a finite amount of time and energy. There is still debate between these two theories as to what contributes to increased alcohol use in terms of the social roles people play. There are numerous factors that play into alcohol dependency, but I think it is fair to say that both of these theories contribute to the literature in a meaningful way. The second scientific peer-reviewed article I want to mention is called Genetic Approaches to Addiction, Genes and Alcohol by Francesca Ducci and David Goldman. From their study on increasing the knowledge of the genetic basis of alcoholism, they discovered that genetic factors account for more than 50% of the variance in alcoholism liability. They also discussed examples of genes that have been shown to influence vulnerability to alcoholism, and they go into more depth on related phenotypes. Ducci and Goldman suggest that an individual's environment, their genes, and mediating factors might all contribute to alcoholism. Examples of a person's environment in this study would be parental alcoholism, parental rejection, physical and sexual abuse, harsh, inconsistent discipline, and later life events. Examples of genes include MAOA, COMT, and HTT, among many others. Examples of mediating factors include alcohol availability, emotional and social support, peer influences, and socioeconomic status. Ducci and Goldman also note that alcoholism coexists frequently with other addictions, including illicit substance abuse and nicotine dependence, more often than would be expected by chance. The third scientific peer-reviewed article I want to talk about is called The Construction of Meaning in Alcohol Addiction, a narrative study of socially excluded people's stories about alcohol, by Lynn Erickson and Bente Hoek. These researchers illuminated the experience of living with alcohol addiction from the perspective of 5 men living in Denmark. Some of the men constructed meaning in their addiction by including an identity as a stereotypical drunk, defined as a certain type of unhealthy, unkempt, low-income addict. Others distanced themselves from that kind of identity. Furthermore, this study found that alcohol was presented with a double meaning, being associated with positive memories and good relationships, as well as negative consequences and bad experiences, complicating a potential wish for sobriety.